Hi, and welcome to Hughes Knows Nursing. I am Veronica Hughes, and we are going to work on a case study today on metabolic alkalosis. So, the person that we're going to be talking about today is named Anita. She is 52 years old, and she's had a bout of nausea and vomiting this past week. And to help treat her nausea and vomiting, she went old school with the remedy of taking some baking soda to help control her abdominal discomfort. So, not as common of a remedy these days, but baking soda used to be given often to help with GI upset, and it sounds terrible. So, but you gotta ask, because sometimes people decide to take baking soda. So, whenever you are introducing baking soda, what would you expect your acid-base imbalance to be? So, baking soda, bicarbonate, right? So bicarb, that is going to be a base. And so you're introducing a bunch of base to the system. And you have to think about if she's had nausea and vomiting, she's been getting rid of acid with that vomiting. So you have kind of a double whammy of getting rid of acid and adding some additional base. So remember, your normals for your pH is 7.35 to 7.45. The normal for our carbon dioxide is 35 to 45, and the normal for bicarb is 22 to 26. So in this particular case, what kind of acid-base imbalance would you think? Or pH, would it be high, low, or normal? Probably high, because she's introducing a bunch of base, right? So remember, basic pH is a high pH. What about the CO2? Would you expect any compensation coming from the respiratory system? I mean, maybe. Remember, the respiratory system can compensate a little quicker than the metabolic system, right? They can decrease, but the problem with particularly metabolic alkalosis is that you can only decrease the respiratory rate so much. So remember, the way that we would compensate for a metabolic alkalosis is we would want to hold on to CO2, because remember, there's an inverse relationship with CO2 and your pH. As your CO2 goes up, your pH is going to go down. So respiratory opposite, right? But I can only slow my breathing down so much, because you've got all these chemoreceptors and things in your brain that are going to be like, we need to breathe, we need to oxygenate, and that's going to take priority. So, yeah, a little bit of compensation maybe, but not a whole lot, because the drive to breathe will take over. Yeah. So, we mentioned our ABG a little bit. That high pH, we're going to have a CO2 that is going to be low, hopefully, or normal. CO2 is going to be normal or high, because we're going to try to hold on to CO2 to bring that pH down. It even gets confusing in my head sometimes. So pH high. The bicarb is also going to be high, because remember, metabolic equal, they trend together. And then the CO2 could either be normal or a little bit on the high side. But remember, nothing crazy, because you can only do so much. So how are we going to treat it? So remember, the underlying issue that caused all of this was the nausea and vomiting. So let's figure out what the underlying cause of the nausea and vomiting is. No more baking soda. Just to let her know that that could be adding just a level of complexity to her problem. So think about other treatment options that she might have. And then replacing any electrolytes and fluids that have been lost. And that will help her feel better too, because as your electrolytes get wonky and as you get dehydrated, that can make you feel even worse. So, yeah. So remember, with metabolic alkalosis, it can be the problem with too much bicarb. So that can happen with prolonged vomiting or gastric suctioning. So if we drop an NG tube and we're just continually suctioning instead of like intermittent suctioning, and we're pulling off too much acid, that can cause that pH to go up. And also an addition of bicarb, like the situation where we were adding the baking soda to the mix. Remember, compensation, your renal system can compensate as long as it's working right to excrete some bicarb. So that's part of the job that your kidneys do. And then respiratory rate, remember we've got some limited compensation by decreasing that respiratory rate, which holds on to the CO2, which can help bring the pH down, but only so helpful. All right, so that was a really quick review of a sample case study for metabolic alkalosis, and hopefully that was helpful.